Good day, everyone. Today's session is about the psychological assessment. In this session, I am explaining about the definition of psychological assessment, the nature, scope, and historical background of psychological assessment. The learning objectives of today's session is to define psychological assessment and to understand the nature, scope, and historical background of psychological assessment. The session outcomes are to understand what psychological assessment is all about, to understand how and where the assessment can be used, to understand when the assessment began and the later contributions to psychological assessment. Let us look into the definition of psychological assessment. According to APA Dictionary of Psychology, that is American Psychological Association Dictionary of Psychology, psychological assessment is defined as the gathering and integration of data to evaluate a person's behavior, abilities, and other characteristics, particularly for the purpose of making a diagnosis or treatment recommendation. Psychologists assess diverse psychiatric problems, for example, anxiety, substance abuse, and non-psychiatric concerns like intelligence, career interests, in a range of clinical, educational, organizational, forensic, and other settings. Assessment data may be gathered through interviews, observation, standardized tests, self-report measures, physiological or psychophysiological measurement devices, or other specialized procedures and apparatuses. Psychological assessment is a general approach that utilizes various sources of data, that is, portfolio, interviews, observations, etc., in addition to a test in order to make decisions. Psychological assessment combines both qualitative, that means the subjective experiences, and the quantitative, that is the objective approach. It is individualized in nature, unlike the psychological testing. It is also called as a collaborative assessment, wherein the assessor and the assessee work as a partner. For example, in case of psychological therapies, how both the assessor and assessee are going to work. It is also considered as a dynamic assessment, wherein an interactive approach that follows a model of evaluation, intervention, and evaluation. To conclude, psychological assessment is a series of tests conducted by a psychologist in order to gather information about how people think, feel, behave, and react to a particular situation. The findings that have been absorbed are used to develop a report of the person's abilities and behavior known as a psychological report, which is then used as a basis to make recommendations for the individual's treatment. Let us look into the nature and scope of psychological assessment. Psychological assessments and reports are used in other fields as well, like in the case of career planning for young adults or in the job application process in order to determine how well an applicant will fit into the open role. The procedures used to create an assessment are interviews, observation, written assessment, consultation with other mental health professionals, formal psychological tests. Let us look into the psychological assessment, how it is going to be used in various settings. It is most often used in the psychiatric, medical, legal, educational, or psychological clinical settings. This type of clinical assessment can be thought of as a broad range of measurement techniques, all which involve having people provide scoreable information about their psychological functioning. The types of assessments and the purposes for them differ among these settings. In the education setting, in order to assess a student's ability to learn and to progress in the classroom, whereas in the legal system, in order to assess the mental health status of a person. In the psychiatric setting, the common needs for assessment are to determine risks, whether a person should be admitted or discharged, the location the patient should be held, and what therapy the patient should be receiving. Within this setting, psychologists need to be aware of the legal responsibilities that they can legally do in each situation. Within a medical setting, psychological assessments are used to find a possible underlying psychological disorder. Emotional factors that may be associated with medical complaints, an assessment for neuropsychological deficit, a psychological treatment for chronic pain, and the treatment of chemical dependency. There has been greater importance placed on the patient's neuropsychological status as neuropsychologists are becoming more concerned with the functioning of the brain. Whereas in the education system, to assess a student's ability to learn and progress in the classroom. Whereas in the legal system, to assess the mental health status of a person. Various tools that are used in the psychological assessment are tests, psychometrics, that is the science of psychological measurement, portfolio, case history data, observation, role play, technology like EEG, etc., interviews, like it can be a panel interview also. So this is how the psychological assessment is going to take place. So first need to be problem should be evaluated, then the intervention is going to be administered, and again the evaluation is going to be takes place whether it is successful or not successful. Based on that, one more intervention is going to be conducted. So let us look into the historical background of psychological assessment. So in the Chinese civil service, first thing is, in China, the Chinese civil service testing was used, wherein the written tests were used to assess the language competence for prospective civil service as long ago as 2000 BC. Second, the testing under error. In mid 1800, Wundt studied mental processes in order to formulate general laws of behavior. It could be used to obtain consistent results for each person from trial to trial. However, differences between people remained. It is viewed these individual differences as errors. Other psychologists viewed individual differences as important phenomena, and it was used as a basis for mental tests. Francis Galton, he thought that intelligence ran in families, and he thought that it was inheritable. So, development of statistics measures the extent to which variables are related, and it allows objective measures of heritability. Second thing, development of assessment of intelligence. The objective is to measure the genius individuals. The contemporary theory of intelligence based on Locke's empiricism observed that newborn's mind is a tabula rasa. So then the knowledge arrives via the senses and to measure obtain index of sensory acuity. So the problem is it measures the sensory abilities were not related to other measures of intelligence and could not demonstrate validity. James Cattell studied with Wundt about the individual differences, and from Galton adopted tests of sensory and motor function, and Galton has coined the term mental tests and prepared US for acceptance of psychological tests. Alfred Binet needed to identify mentally retarded children, and then Binet separated mentally retarded from mainstream children and measured higher intellectual processes. Binet has assumed that intelligence grows with age throughout normal childhood, and according to Binet, the best index of intelligence is the verbal ability. Then, along with Simon, Binet developed a scale in 1905 and it has been re-revised in 1908. This Binet-Simon scale consisted of 30 items in order of difficulty. So it assessed memory, judgment, and reasoning. And this test also has distinguished younger children from older children. And the scores on this test were increased with age for each child, and the scores were correlated with school grades and with teacher ratings of intelligence, and the test tried to distinguish between mentally retarded from normal children. Later on, Lewis Terman in the Stanford University has identified, along with the Binet, the Stanford Binet test was used for, and this test was normed on 1,000 American kids aged between 3 to 13 years of age. Later on, David Wechsler has developed the test for adults, and then the revised scale for children was also used, like WISC, Wechsler Intelligence Scale for Children, and Wechsler's Pre-Primary School for Intelligence. So the World War I has given way for the development of group intelligence tests. One is the Army Alpha test for the literate group, and the other one is the Army Beta for the illiterates or non-English speaking recruits. To summarize this session, psychological assessment is defined as the gathering and integration of data to evaluate a person's behavior, abilities, and other characteristics, particularly for the purposes of making a diagnosis or treatment recommendations. Psychological assessment can be used in different fields to help individuals to achieve their goals, plan their career in psychiatric setup and in industrial setup, in treating and guiding the needy, and in legal setup, and much more. The psychological assessment first started in China, and later many scholars have contributed to its growth and for its development. Even in current society, the psychological assessment is being used to the welfare of the organization. Thank you.